Hello, and welcome to this discussion about the rules of the NCLEX examination, or living in NCLEX land. Now, when students first hear this title, many times they say, rules? What are you talking about, rules? All standardized exams has its own set of rules, and it is much easier to select correct answers if you understand what the rules are for the particular standardized exam. In this case, it is the NCLEX examination. Now, I always think about the time you are preparing for NCLEX as the time that you're living in NCLEX land. Between now and the time that you go in to take your test, you're preparing for the test, you're worrying about the test, you're thinking about the test. So what I want you to do during this time is also understand what the rules of the exam are. Now, sometimes students aren't crazy about the rules. They say, I don't like them. They're different than the kind of rules that we operated by in nursing school, on nursing school exams, and that's okay. You may not like it, but as long as you understand it, you will get more right answers. And don't lose sight of your goal. You want to pass NCLEX the first time. Our learning objectives for this discussion are that you identify the rules of the NCLEX examination and that you apply the appropriate rules when answering NCLEX-style test questions. Now let's start with rule number 1. The NCLEX examination is a test about the judgments you make as a nurse. Please don't lose sight of that. NCLEX is not testing what you know about nursing. They're also not testing what you understand about nursing. What they are testing on this exam is the judgment that you are going to make when you are caring for clients, when you're interacting with family members, the healthcare delivery team, or other staff members. So don't lose sight. If you memorize enough content on this exam, does it guarantee success? And it does not, because they are testing your judgments. Rule number 2, this is not the real world. And I know you've dealt with this sometimes in nursing school where you see a correct answer on an exam and you say, but this isn't what they do on my floor, or they don't do this in my clinical area. Please remember, on the NCLEX exam, correct answers are based on textbook theoretical nursing practice. What National Council says is that they validate all of their correct responses in 2 sources. The primary source, or the first source, is a core nursing textbook. The second source would be an article, a journal, or some other reference. So remember that. I want you to be really careful and not answer questions based on what you've seen on your floor. Know that the correct responses are listed in textbooks. There is no limitations on staff, time, or equipment on this exam. So if you think the best answer to a question is to sit with a patient and hold their hand, your next thought should not be, yeah, but who really has time to do this? On the NCLEX examination, you always have the time, you always have the staff, you always have the equipment. And this is a good thing because they're taking out those kinds of things for your consideration. As I said earlier, please do not base your answer on what you've seen in your clinical area. The reality is when nurses are practicing, sometimes we take shortcuts, and these shortcuts don't harm the patient, but it is also not what is said in a book that is the best answer for that particular situation. So for those of you all that have a lot of clinical experience, either through nursing school or because you worked as a nursing assistant or you're an LPN, please be very, very careful about using your experience to answer the questions. Use your experience to help you visualize and understand what they're talking about in the stem of the question, but when it comes to answering it, you're not going to use the real world. And guys, sometimes nursing students say, well, they'll say this, well, this isn't the real world, and they say it in kind of a sarcastic way. But when I think about this, I'm an RN in the state of Missouri, and if I were taking a test, I don't want to be answering questions based on standard nursing practice in a different state. I don't know it. So it is to your advantage that this is not the real world. You always have the order on the exam. So if you think the best answer is increase oxygen to 2 liters per minute, assume that you have the order to do this. And sometimes this makes you feel pretty uncomfortable because what you were taught in school is orders can be independent, dependent, or interdependent. And you might have had the experience in nursing school, especially early in your education, where you had a question, what should you do for this patient who's short of breath? And you did select that answer, increase oxygen to 2 liters per minute. And as it turns out, it was counted wrong. And what your faculty said to you was, I did not tell you that you had an order for that. It wasn't written in the stem of the question. So if you've been in that situation, you're very used to identifying what is a dependent and independent nursing function, and you're also really used to going back into the stem of the question and making sure you have an order for those dependent nursing functions. But on this particular exam, you do always have the order. Faculty, when they do that, what they're really testing is, do you know the difference between an independent and a dependent nursing function? National Council simply assumes you know the difference. And so that's never going to be the point of their test question. So rule number 3, you always have the order. Rule number 4, do not pass the buck. On this exam, they are testing what you are going to do as the nurse. So the correct response is within the scope of nursing practice. Now, passing the buck means that maybe you've got a setup where something's going on with the patient, and one of the answer choices is for you to assess lung sounds, and then there's a second answer choice that says contact the healthcare provider. Well, that would be an example of passing the buck. So, if there's an answer choice that says contact the social worker, contact the nutritionist, contact the clergy, contact healthcare provider, what I want you to do is look at those other 3 answer choices very carefully and make sure that there's not something there the nurse should do first before they contact whomever the answer choice is suggesting. So again, I'm not saying don't ever pick an answer choice such as contact the healthcare provider, but all I'm saying is if you think that's the best one, be very, very discriminating and look at the other 3 and make sure there's not something you should do first. Rule number 5, take care of the client first and then take care of the equipment. This is a way on the exam when they ask a question, which action does the nurse take first, that they discriminate. It's a higher level question. So if you think about it, maybe you're caring for a patient in OB, and there is an answer choice there that says after the bag of waters is ruptured, which action should the nurse take first? Should the nurse monitor the fetal heart tone? Should the nurse look at the fetal monitor? Now, I understand that when you look at the fetal monitor, you have a pretty accurate description or measure of what's happening with the baby. But NCLEX wants you to do the hands-on thing with the patient first, which is monitor the fetal heart tones before you look at a piece of equipment. So if you think about this, this will help you get more right answers too.